Obesity is not something that's good for the kidneys if you have reduced nephron number. So most people have about 1 million of these nephrons, the little filtering units in each one of their kidneys. So you have so many nephrons that you can donate a kidney and your kidney function doesn't even change that much. But some people are born with a reduced nephron number. Maybe they were born prematurely or they had genetic reasons that might have caused them to have reduced nephron number, or you have developed a chronic medical condition that has caused you to lose nephrons, like type 2 diabetes or type 1 diabetes, or maybe you've been exposed to like chemotherapy agents or something that has damaged the kidneys and led to loss of those nephrons. So, in the setting of obesity with reduced nephron number, it's really a catch 22 because in obesity, you have to increase glomerular filtration rate and increase renal plasma flow in order to meet the increased metabolic demands of the bodies. Because as you gain weight, your metabolic rate actually increases. You just have more body surface area that's creating these toxins that your kidneys have to get rid of. You're eating more calories and more protein that your kidneys have to metabolize. So if you have reduced nephron number, those remaining nephrons have to work a little extra harder anyways. So if you compound that with obesity when you have to increase glomerular filtration rate again, then that means you have a reduced number of nephrons that have to work really hard, and then the obesity makes them work even harder. So it's kind of like if you had a shoe factory and you fire, 3/4 of your employees, and then all of a sudden you say, "Oh, by the way, we have to make 3 times as many shoes as what we normally do." And so people get tired in that shoe factory. Same thing with those nephrons in the setting of obesity and reduced nephron number, they just kind of wear out. So you have to increase the glomerulocapillary that leads the glomerulocapillary flow. So that means you're going to actually increase the pressure inside of each one of those nephrons. And that higher pressure can lead to, we call it barotrauma, loss of the nephrons, and it leads to scarring, increased urine protein excretion. And so that's why obesity is a risk factor for kidney disease progression. Really severe obesity, like BMIs above 40, I think can also even lead to nephron loss itself just because of all of the inflammatory effects that obesity has on the body. And usually you also have diabetes and hypertension. So all of those things kind of can actually cause nephron loss itself. Well, medical nutrition therapy is covered by Medicare with no co-payments, so there's no cost sharing to the patient. And most private insurance is the same way, so that as long as a physician has referred the patient to a registered dietitian, and any of the codes for chronic kidney disease can be used to refer a patient for medical nutrition therapy. So then that patient then can meet with a registered dietitian for up to 3 hours for the first year, and you can renew that as well. Like if they need more therapy, you can just reorder the medical nutrition therapy. And so talking with a registered dietitian can actually be done through telehealth. And if you don't have a registered dietitian that you in your within your own practice, what you can do is you can actually go to the National Kidney Foundation website at kidney.org, and you can search for the dietitian, and they actually have a web page that lists all of the registered dietitians who have specific training in nephrology, and then you can actually reach out to them through email or through fax and send them a request to see a patient. And many dietitians actually practice in multiple states, if they're licensed in multiple states. So, but only about 10% of patients ever meet with a registered dietitian. But then when they get on dialysis, everybody talks with the dietitian. So it really makes sense that we should try to get our patients to be talking with a registered dietitian to slow kidney disease progression and get them to eat healthier.